And before I read out Tania's bio, I do need to clarify, we did have a mix-up with the organisation she was from in the manual. So to clarify, yeah, Tania is representing Tree of Compassion today. So Tania is a fauna ecologist and qualified veterinary nurse. She has worked for over 25 years for the New South Wales Department of Planning and Environment on threatened species and now manages animal research ethics. She has also worked with Dr. Howard Ralph for almost 30 years, rescuing and treating wildlife victims of natural disasters such as bushfires and earthquakes and man-made disasters such as oil spills, both in Australia and overseas, providing training to wildlife carers around Australia and on animal rescue and treatment overseas. She also works at the Southern Cross Wildlife Hospital. Over the years, she has cared for many species of wildlife. Tania is director of Tree of Compassion, a charity and animal sanctuary in Kathmandu, Nepal, with projects in India. Tania has published 2 guides on wildlife care, Introductory to Fluid Management in Wildlife, and Bushfires, Burns, and Their Management in Animals. Tania's work featured as the cover story for the October 2017 issue of Vet Practice magazine. Thank you, Tania. That's your next. Okay. Back and laser, if you need it.
Alrighty. Right, I might have to, I'm at that age where I have to either have them on or down. Anyway, all right. Thank you, everybody, for being here, and for those of you online. And Di and Alan, I know you're online somewhere. All right, so my topic is first aid for fauna. So whilst I think the theme for today is about medical advancements and stuff, mine won't cover a lot of that stuff because I'm looking at what you can do as wildlife carers or rehabilitators as opposed to veterinarians. So it's very much first aid stuff, which you may or may already know. All right, I have to take them off. Okay, so as you know, the Dean just read it out that Dr. Ralph and myself have been responding to disasters like fires for, in January, to be 30 years, makes us sound old. So yeah, for a long time. So we have seen a lot of fire victims and burns victims. Unfortunately, bushfire is becoming more prevalent in many parts of Australia, but also the world. Like some of you would have seen the news, sadly, today about 52 people now have died in Hawaii. Fires there, and in Greece and in Italy and Algeria, California, there's fires, and this is just right now. So unfortunately, fires are becoming more and more commonplace around the world and becoming more severe and intense. In Australia, we're getting more intense fires, but whilst our flora and fauna do have some adaptations to that, it depends on the intensity and the frequency of the fire that really is the big impact on them. And we do get, as we all know, which is why we're here, a lot of our victims, unfortunately, are wildlife. All burns require veterinary attention, and I know that there are some people that feel that they can treat them themselves. This is never going to be a good idea. Veterinarians will have a better understanding of what's going on with the animal, because it's not just what's happening on the outside, but it's also on the inside. They also have access to general anaesthetic, which all animals will need, at least initially, to be properly assessed and treated. And they'll also have access to drugs, which they're going to need as well. Oh, why is nothing coming up on that? Oh, yeah, okay. So fire is a natural part of our landscape. As I mentioned, it's an ecological process, and some plants, particularly over here, you've got things like Hakea and Banksia, which really require fire to germinate. But again, it's that fire interval that might actually wipe them out if it's too frequent. It determines the composition of our flora and fauna in Australia. Many species are adapted to fire, like Hakea and Banksia. And different species are sensitive to different components of a fire regime, which again is that intensity and the timing and frequency. So in, I don't know about here so much, but in New South Wales, Queensland as well, we do a lot of, I know you do it here, hazard reduction burning. And that depends on, we look at the interval between fires when we do that sort of thing, because in some places they don't actually know what the interval is for that particular vegetation community, and you might actually end up wiping that community out or changing the composition of that vegetation community, which is then going to impact your wildlife species that live there as well. You should all know this stuff, so this is not an exhaustive list, so this is just some of the things that you might need to take with you if you're going out on a fire rescue. And this is, of course, assuming you're allowed into the fire ground, so I won't get into that, but that's a whole nother thing. So assuming you are allowed, and if you're not, I don't know about it, take various carry cages. So think about the species. So do a bit of research before you go. What species are likely to occur in that area? Are you going to get big macropods? Are you going to get little possums? Are you going to get reptiles? Are you going to get koalas? Maybe not so much over here unless you're in Yanchep National Park. But you might need sacks, like these ones are really handy, these canvas ones, and on the other side we'll have Australia Post, but you didn't see that. Towels, blankets, leads and collars, like often, depending if you're in a built-up area as well, you might come across companion animals as well. Disposable gloves, hand gels, flagging tape is handy because the landscape will be completely different. Even if you're a local and you know that area, you won't recognise it. So if there's something to hang flagging tape, like a bright fluoro yellow or pink or something, usually colour that won't occur in the environment's probably better. Binoculars, of course, notebook and all that sort of stuff, and I've written flagging tape twice there. Wire cutters, which are good for barbed wire, and pliers, and hot water bottle and those instant heat packs are also handy. I just realised that the slide order here is going to be different from what's in your notes if you're following that. I've sort of jiggled it around and added a few things. This isn't in your notes, but I added this. This is at a fry some years ago, and I just put it in because these stretchers, this guy had these old World War II or something stretchers, and they were really great for carrying big kangaroos. So if anyone sees those in an old army disposal store, nab them. They were just perfect for that stuff. Medical supplies, again, depending on what you're going to be doing or who you're with. These are just some basic things that you should probably take with you: some sterile syringes and needles, alcohol wipes, fluids if you got, and you know how to do that. Saline solution, eye flush, betadine solution, povidone iodine, scissors, plain dressing forceps, eye drops, pipettes, clean bowls, sterile swabs, gauze swabs, bandages, blah, 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 and pain relief if you've got it. And if you don't, even if you've just got oral paracetamol for mammals, would be useful. So as first responders, we have certain responsibilities and things that we're going to be wanting to do. So obviously the first thing is to check that it's safe to actually approach the animal. This may seem logical, but in a disaster situation, often things are not logical and people often rush in without stopping to think. We want to be able to capture the animal and move it to a safe area. We want to apply first aid, including pain relief. We want to stop the burning and cool the wound, but not the patient. We want to treat for shock, and I'll talk about this later. And transport the patient to a veterinary facility for treatment, or to a veterinarian if you don't have one on your team. So first aid is in animals is the same in humans, basically. It's that Dr. ABC thing. So the first one is danger. So you want to check that it's safe for the animal and safe for you. So for ourselves, there's many, many hazards on the fire grounds. There's falling trees everywhere, like in this picture. There's those holes in the ground that you don't see and you walk in and you fall in because something's burnt out. There's down power lines. There's a lot of things that you don't see, barbed wire, covered in soot, all that sort of stuff, which is why you have on your PPE, even though it's stinking hot, it's safer to do that. And I've been into a fire in the bush where a house was burning down, and it was an artist's facility, and at that time, many years ago, I didn't have PPE on, and I was trying to cover my mouth because all I could smell was the fuel of the paints burning, and eventually a fire crew came, but you don't realise how hot those flames are until you're, right there amongst it. Make sure it's safe for the animal. The animal's going to be scared. It's going to be traumatised. It's going to be stressed, confused. So we have to take that in mind with what we're going to do next. Then our response. So there's two, of course. There's ours and the animals. So for us, again, we want to assess the situation and plan our approach. And then we want to think about how we're actually going to safely capture and transport, lift the animal into the container or bag or whatever and transport it. And then the response of the animal. So have a think about and try and check out their level of consciousness. Are they alert or are they unconscious or semi-conscious? So all these things you need to think about before you actually physically approach the animal. So the next one we've got is the airway. So we want to make sure that the airway is clear and the animal can actually breathe. This may sound obvious, but it's not always that obvious. If it's unconscious, then we want to check the mouth and remove any obstructions, pull out the tongue and extend the head a bit. Observe their breathing, what breathing pattern they have. Assess for any respiratory distress. Are they wheezing? Is there any singed facial hair around them? Open mouth breathing, facial swelling? Are they panicking because they're having difficulty breathing? Any of these things can indicate that their airway may be at risk, and that's life-threatening. So you need to get them help ASAP. So their airway may actually be, their breathing might be compromised because of mechanical restrictions. So this could be from circumferential deep dermal burns, which is limiting their chest expansion. It might be from a secondary injury. So they might have an injury to their lungs from penetration whilst they're fleeing the fire. Often animals are rushing out to get away from the fire and then they incur another injury. Or it might be from smoke inhalation. Circulation, so we need to check for the circulation. Check heartbeat, the pulse rate and quality. So before you sort of embark on this, it's a good idea to familiarise yourself with what's normal. What's a normal heartbeat in whatever animal you're likely to incur. What's a normal heart rate, beat, pulse rate and all that sort of stuff. Because if you're then checking when you're out there and you've got no idea what's normal, then you're not going to know whether it's abnormal. Mucous membrane colour. So there was a slide that Dr. Ralph had on earlier and you could see the pale blue colour. So check for that. And the capillary refill time, whether it's slow or quick. If there's any bleeding, you obviously need to control that by putting gentle pressure on it or a non-stick pad or both. And if they're not breathing and there's no pulse or heartbeat, then you need to start CPR straight away, which I'm not going to go into, but useful if you know how to do that. Oh, there you go. So most of the animals coming out of a fire that you may see are going to have burn injuries. Not all of them, but some will, depending on where you found them. Burn wounds are complicated wounds. They're not simple and they're not easy. And just as with humans, they require specific medical treatment. So if you're, at home and you get burnt or whatever, your house burns down, you don't just go to your normal GP. You would go to a specialist burns unit. So the same with animals. It's not something that most people know how to treat, and they may think they know a bit, but they're complicated. And so I know from experience that in fires, people sometimes think they can do it themselves, but trust me, it's not a good idea, and the animal's probably going to have much more pain and suffering if it didn't have appropriate veterinary treatment. The major determinant of prognosis is the severity of the injury. And again, this is something that a veterinary with experience in burns is going to be able to determine. But first aid that you can do, that we can all do, is going to greatly make a difference and help that animal. The classification burns into minor or major injury depends on their location, the depth and the surface area. And there is slight variation in this. between different experts, but they're more or less similar. So before you know about burns and how they operate, you need to understand the functions of the skin. So they've got 5 major functions. So the skin has its protection, fluid balance, thermoregulation, it's a sensory organ, and it produces vitamins. So it's a pretty important thing to have, skin intact and not burnt. So these are the basically 3 layers of the skin. So the epidermis, which is the outermost layer, and it has no blood supply. There's the dermis, which you can see there. So that's the middle layer, which has nerves and blood supply. And then there's the subcutaneous tissues below the skin and above the muscles. And those of us that do subcutaneous fluid injections will know where that layer is. So all this affects what type of burn and how you treat it. And just keeping in mind that the body's constantly replacing its skin. So along with burn location, burn depth is used to determine the long-term prognosis of that patient, the treatment it receives, he or she, and the management of the burn injury. So as I mentioned earlier, the depth of a burn is a subjective assessment by the veterinarian. And burn depth is not homogeneous, so it's got different depths. It's not just this one thing, and it changes over time. But prompt first aid can actually influence the burn depth. So there's a bit of a picky. Put my glasses on again. So yeah, and again, there's different names for this. So here I've got epidermal, partial thickness, full thickness. Sometimes people say superficial burns, and then within that there's partial thickness, semi-partial. There's a whole pile of different categories. Or some people refer them as 1st degree, 2nd degree, 3rd degree. That's sort of changed now, but basically that's what it is. So you've got the different layers of skin. You can see where the burn's penetrating, and so you can see that middle one in the dermis and where all the nerves and everything are, and then the full thickness, which has gone way beyond that, which is often where they don't feel a lot of pain because it's burnt everything. Right. So more animals will actually die from inhalation of heat and smoke than the fire flames themselves. So I always hear this in fires, and people are going, oh, how many animals you must be overwhelmed with animals, blah, 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 burnt animals. And it's like, well, sometimes depending on the fire, but often the animals die before they even get burnt. And that's because of the smoke. So, and that in itself is a big problem if they're actually not dead and they've had smoke inhalation. Facial burns are a really big issue. So they can be life-threatening either early or progressively, so that it does change with the swelling. So the management of the airway is a priority with facial burns. So the signs, so if you have an animal and you suspect, or you can see that there's burns to the face, there's soot in the nose or the mouth, or the hair, the whiskers and all that are singed, then suspect that there's damage to the mouth, the nasal cavity, the airways, the lungs, the esophagus, etc. And then you'll need urgent veterinary attention, because whilst it might look like it's just this external thing, it's affecting everything in here in the way they breathe. So providing first aid includes pain relief, and that was mentioned earlier, and then veterinary assessment. So the tissues actually continue to be damaged. And if you think about what happens in a fire, things are burnt, the animals might still be in there, they might have sheltered somewhere, but then they come out and they're crossing that burnt ground. So I'm digressing here for a second, but I was recently at a cultural burn. My husband works in Aboriginal heritage stuff, and in fact we're up in Cairns doing cultural burning workshop next week. But anyway, and the way that they did the burns, and these are like hazard reduction burns, was really cool, slow fires. And you could actually walk through that area and you could see the bugs and lizards. Like, I'm like, quick, run away, you know, me and this other girl trying to get them off the path. But you didn't really need to, they got away. And you just scraped a bit of the ash off the top and put your hand there straight away afterwards, and it was cool. So the animals actually had a chance to get away. It did its job from our perspective of, reducing hazards and all that sort of stuff, but it's not that widely practiced just yet. And unfortunately, some of our fire authorities, when they're doing a lot of the burning, they use because they're using fuel, it's often really hot and intense, and so it changes the fire, and unfortunately animals don't have much opportunity to get away. Any delay in treatment of either first aid initially or treatment of the burn will actually compromise the patient and usually lead to a worse outcome. First aid, so cool the burn is an obvious thing that we think about. So you cool it with tepid running water. You don't want to use cold water, and you don't want to use cool water. It's just tepid water, room temperature. So animals, humans, whatever, the latest is just tepid water. This is really important. This removes heat and minimises further damage. It decreases pain, so if nothing else, that's a really good thing. It cleans the wound. I mean, you can see in that photo there, you can see that there's some stuff stuck to it, grass or whatever, sticks and bits and twigs. And it minimises swelling. So cooling burns is apparently useful up to 3 hours post-injury. For 20 minutes, you do it for 20 minutes. But as most of us know, it's unlikely we're going to get wildlife in this time period, but it's still useful because it still gives pain relief and it still cleans the wound. So there might be instances if we're at the property itself while it's being burnt that we've got an animal within that time frame, but most of the time we're not, but still, it's still a good idea to, the first thing that you do is to flush that with tepid water. If you don't have running water, then you can immerse the body part if possible, keeping in mind what species you're dealing with, in tepid water. You can use towels or wet compresses. You can use hydrogels, but they're the least effective. I mean, these packs aren't that great, but if you've got nothing else, and I know we all get dumped with these things when people donate their expired first aid things from their office, tons of them. We just have to now throw them out. We've got so many. And use it for only 20 minutes. And you'll have to keep changing them. So use the towel, it warms up or it gets dirty, change it. Don't just keep it there and keep using it. Oh, well, it's not 20 minutes yet, I've got to keep it. So don't use ice or very cold water. And don't use butter, ointment, salves or creams. People are tempted to do these things, but it's not a good idea. And the above can actually worsen the injury. So as I mentioned earlier, you want to cool the burn, but not the patient. So cooling is actually most beneficial for partial thickness burns. And prolonged cooling of large burns can actually lead to hypothermia. So whilst it's hot outside because it's summer or whatever and it's a fire, we think, oh yeah, we've got to cool the patient, but we don't want to do that. They're already compromised. We want to cool that specific area that's burnt, but keep them warm. Prolonged cooling of actual deep burns probably doesn't do a lot anyway. All right, so we want to cover the burn. Glasses back on. So generally, after cooling the burn, we should try and cover it. And this is particularly good if it's blistered or looking raw. This prevents it drying out and also prevents bacteria from growing, getting into it. And it also relieves pain from exposed nerve endings depending on where the burn is and the depth of the burn. So there's various things that, depending on what you've got available with you at the time. Obviously using a non-stick sterile dressing is better than using something like cotton wool. Never, ever, ever put cotton wool on a wound. Just cover it with a non-stick dressing, or if you've got nothing like that, a clean cloth, like something's better than nothing. A good emergency dressing is plastic film, like cling wrap that you use for your sandwiches, if you're particularly non-environmentally friendly. But don't put it circumferentially because you'll just constrict everything. And don't do it in a hot, humid climate. So if you're up north in tropical areas, you don't want to cover it. Again, take it to a veterinarian straight after that. And don't apply creams or ointments. Don't be tempted to put anything on it. You might think, oh, well, this aloe vera gel or whatever it might be. Don't. Just cover it, get it to attention. And don't try and pick at it or do anything to it. There's some, I'm just going to mention here, not that it's first aid stuff, but there's been a bit of talk about new technologies and stuff. So there's a whole pile in that book on my table that I wrote. There is a lot of research going on into burns in humans at the moment. Most of it is not going to be relative to animals. There's things like biocell technology and stuff where they, take a bit of your skin and graft it and then put it back on you after they've done something to it and all that sort of stuff. That we're not going to have access to that sort of stuff, and even if we do, it's going to be super expensive. There's been talk about fish skins, and whilst the latest papers on those, there's been some initial good results, but it's only been a small cohort. So the studies have been really limited and really small. So and they're not being used at all in humans. So this is just animals. So until there's more data and more evidence, then there's no reason to use it. I wouldn't use it. And particularly also, we have so many fantastic dressings here. We don't have to change a dressing every single day. It depends on how much exudate you have, what's going on with the wound, what access you have to a veterinarian, general anaesthetic, all that sort of stuff, and what type of dressing. Like, there are so many for different situations. So, and the other thing about skin, which some people will be concerned about, is you're using the skin of one animal for another animal. So there's ethical issues there as well. But, we'll see what happens in a few years' time with the information there. First aid for facial burns, as I said, this is an urgent issue. They require urgent attention. So again, extend the head and neck if there's facial burns or difficulty breathing. So this is you out on the fire ground, you out with the animal there. The vet's not with you. This is what you're trying to do. Keep the patient's head upright. Flush the burn if possible. Don't use any closed dressings on the face. Try and keep it moist or something. Don't use SSD cream on the face. There's a lot of data on that as well. It's actually not the best one to use, Famazine. And note facial edema, i.e. swelling. It might be a little bit now, but in another couple of hours it might be much bigger. So this requires urgent attention. Ocular burns, so burns to the eyes. So the eyes can be directly affected by the fire itself. They can be affected by the heat, and they can be affected by smoke and debris. And you can see this poor wallaby. This is in a fire, actually in Victoria. So ocular burns require urgent attention because we're talking about the eyes that we want to obviously save if possible, because they are very useful. Talking about someone that has to keep changing theirs. Always suspect burns to the eyes if you notice facial burns. If there's any crusting around the eyes, weeping if the eyes are closed, and you may not be able to see what's going on underneath, but the animal just won't open up their eyes. If they're squinting or the animal appears blinded. I don't think I've got much more. First aid for eyes makes a huge difference to the animal. And I will rush here. So flush with copious amounts of saline or clean tepid water, clean for about 15 minutes if you can. And the cooling will prevent further damage and will give instant pain relief. And you can imagine when you've got something in your eye, you just want to keep flushing it out. Pain relief, huge, important topic. Pain in burns can be severe and it's often inadequate pain relief. And it's obviously the compassionate and thing to do, and it will help with healing. And there's many ways to control pain depending on the situation, what you've got access to. So manual restraint, as in this little duck here. Flushing the eyes, we talked about. Cooling of the burn, we talked about. Reducing mobility if injured. So if there's a fracture or something, try and splint, apply bandages or whatever, so it's not, flapping around, getting worse. Calming devices, so that might be a bag or a towel over the head or a box. And stress, managing stress is a major factor, and Howard talked about some of the implications of that before. This means minimise noise, minimise handling, minimise viewing. You know, don't go around taking photos or having big film crews come in wanting to take pictures of video or whatever. Chemical pain management, again, depends if you've got access to a veterinarian. Oral paracetamol for mammals is a good one if you've got nothing else, because you can get that yourself from the chemist, 10 milligrams per kilo. Meloxicam is not recommended for burns. I know a lot of people use it, but not. You can talk to Howard about that later if you want to. Especially in animals, any animal that is any non-steroidal anti-inflammatory. So I'm not just talking about meloxicam, it's just because it's commonly used. For any animal that you suspect is dehydrated or is stressed, which our wildlife's going to be. And just remembering that sedation is not analgesia. Useful, imperative, but not alone. Shock, assume that any animal coming out of fire is suffering from shock, dehydration and stress. Clinical shock, so people often say shock, but what is it? It's a clinical situation, there's different types. It can be fatal if left untreated. It's a medical emergency. They'll need fluid therapy immediately. And what you can do is provide first aid, keep it warm in a dark, quiet place, and then get to a veterinarian. Again, it's tempting to think because it's hot that you need to keep them cool, but no, you want to keep them warm and then get to a vet. All right, fluid therapy very quickly. Burns victims always benefit from fluid therapy. We've heard a little bit about this in other talks. Also makes the animal feel better, it improves their survival. Major burn means major fluid loss and nutrient loss, and in shock, fluid's always essential. Initially, they might take oral fluids if you can give it to them, but don't force them, as you'll end up with other issues like aspirational pneumonia. If you can get, if you know how to give by subcutaneous injection, then do that. Assume the animal's 10% dehydrated. And this is a good formula that you can use for burns, and that'll be in your notes anyway. Only give a portion of the fluids, don't give it all, the 24-hour amount, don't give it all in one hit. Use normal saline, sodium chloride 0.9%, or pediatric fluid, saline with glucose if you've got it as a first response. Don't give Hartmann's, again, something I know people want to use, unless you can get access to blood tests regularly and test their lactate and potassium levels. This is really dangerous, particularly with our wildlife, particularly with macropods. This myopathy. Treat other injuries, they may be more urgent than the burn, and I'm rushing. Bleeding, control the bleeding, obviously. Fractures is a common one that we see in fires, so you need to immobilise it. Lacerations, or they might be orphaned. So, in conclusion, main objectives of first aid are keep the patient alive, important, make the patient comfortable, important, and provide pain relief. And try and prevent the situation from getting worse. First aid is the only thing that action rescuers and carers can provide. Carers can't diagnose unless they're veterinarians. They can't prescribe drugs and they can't treat burns. Give first aid and then get to a veterinarian as soon as possible. And you might have a vet on your team, which would be useful. Any delay will compromise the patient and lead to a worse outcome. If you want to know more, you can grab me. I've got a few of these here, and fluid manual. I know some people were after that. So that's it. 2 minutes, look at that. This is from a fire, Greater Glider.
Look, Tania, thank you so much for your presentation. Sorry, don't want to rush you again. Yeah, did anyone, we've got 1 minute 30 for probably a question or two. If anyone like a question. Yep. Yvonne, if you can make your way just to the microphone, might just need to scoot a couple of people over. We'll probably just have one question then. Tania, are you hanging around for afternoon tea?
Yeah.
Tania will be here at afternoon tea as well, so if anyone has questions, please feel free to come up. Can we just get the mic? One of the handhelds. Try again.
I was just wondering what the prognosis of full thickness burns were on a macropod.
direct that to a veterinarian. It depends on where it is, how much of the body it's covering, who's going to treat it. You know, it's not always a death sentence. And that's the other thing I wanted to make a point about, is that a lot of animals, especially the ones that we treat coming out of fires, a lot of them go on to survive and be released. So, you know, this thing about, oh, well, you know, euthanize, it looks bad, or it's got this percentage of burns. It's not always the case. Like, it's a case by case thing, even with full thickness burns. It depends where they are. So, yeah.
Can everyone just give Tania another round of applause, please? Thanks, Tania. Appreciate it.